Today I am going to discuss about what is hemolytic anemia. So I am first discuss about what is hemolysis, then I discuss about what is hemolytic anemia. If you want to interested about that, so please see the full video to know more things, to know more about hemolytic anemia. So let's start.
Hemolysis. What is hemolysis? It is the breakdown of RBC with the release of hemoglobin into the plasma or serum. It can damage host cytoplasmic membrane, causing cell lysis and death. It is rupturing of RBC and release of their content into surrounding fluid. The red cell membrane is fragile and easily damaged if blood specimens are bad. It is of two types. One is intravascular hemolysis and another is extravascular hemolysis. When hemolysis occurs and leads to a RBC imbalance, it is called hemolytic anemia. It is a form of anemia due to hemolysis. Now I am going to my topic, that is hemolytic anemia. So what is hemolytic anemia? Hemolytic anemia is a condition in which red blood cells are destroyed and removed from the bloodstream before their normal lifespan is over. Decreases level of RBC in circulating blood, that is called anemia. It is also known as erythroblastosis fetalis. It is the breakdown of RBC in premature condition. Normally RBC lifespan is 120 days or 4 months, but it is the condition where RBC breaks down at the premature condition. Red blood cells are disc-shaped and looks like donut without holes in the center. These cells carry oxygen to your body. They also remove carbon dioxide, a waste product, from your body. Red blood cells are made in the bone marrow, a sponge-like tissue inside the bones. They live for about 120 days in the bloodstream and then die. White blood cells or WBC and platelets also are made in the bone marrow. White blood cells help fight infections. Platelets stick together to seal small cuts or breaks on blood vessel walls and stop bleeding. When blood cells die, the body's bone marrow makes more blood cells to replace them. However, in hemolytic anemia, the bone marrow cannot make red blood cells fast enough to meet the body's need. The antigen are treated as foreign by mother's immune system. These antigen are treated as foreign by mother's immune system and antibody are produced against those fetal antigen. Anemia also can occur if your red blood cells don't contain enough hemoglobin. It is a type of anemia. It is a specialized type of anemia which is hemolytic anemia. I am discussing about this type of anemia. Rarely, anemia is due to problem that causes the red blood cell to die or be destroyed prematurely. Normally, RBCs live in the bone for about 4 months. In hemolytic anemia, this is shortened sometimes to only a few days. In most instances, the mother of Rh negative and fetus is Rh positive. Every person has a distinct blood group type, that is A, B, AB or O. If you receive An incompatible blood type, specialized immune protein called antibodies, will attack the foreign red blood cells. The result is an extremely fast destruction of red blood cells which can be lethal. Hemolytic anemia is caused by high rates of red blood cell destruction. Many disease, conditions, and factors can cause the body to destroy its red blood cells. Anemia has three main causes. One is blood loss. Second one is lack of red blood cell production, or another is red blood cell production, or another is high rates of red blood cell destruction. The condition can be inherited or acquired. This condition may be inherited or acquired. If inherited occurs, what is the meaning of inherited? Inherited means your parents pass the gene for the condition on to you. Acquired means you are not born with this condition, but you develop it. Anyone of any age can develop hemolytic anemia if red blood cells are breaking down abnormally. There will be fewer of them to carry oxygen. Hemolytic anemia can be intrinsic or extrinsic. Hemolytic anemia, it may be intrinsic or extrinsic. For intrinsic, the destruction of the red blood cells is due to a defect within the red blood cells themselves. Intrinsic hemolytic anemias are often such as sickle cell anemia, thalassemia. These conditions produce red blood cells that do not live as long as normal red blood cells. Intrinsic property, that is the destruction of the red blood cells, is due to a defect within the red blood cells themselves. Intrinsic hemolytic anemia are often inherited, such as sickle cell anemia, thalassemia. These conditions produce red blood cells that do not live as long as normal red blood cells. Intrinsic hemolytic anemia develops when our red blood cells produced by your body do not function properly. This condition is often inherited, such as the people with sickle cell anemia or thalassemia. Other names of metabolite abnormality, such as in people with G6pd deficiency. People with G6pd deficiency. Now, what is extrinsic property? What is extrinsic property? Extrinsic property, that is, red blood cells are produced healthy but are later destroyed by getting trapped in the spleen, destroyed by infection, or destroyed from drugs that can affect red blood cells. In severe causes, the destruction takes place in the circulation. The following lists some of the causes of extrinsic hemolytic anemia is also called autoimmune hemolytic anemia. Extrinsic hemolytic anemia developed by several methods when the spleen traps and destroys healthy red blood cells or an autoimmune reaction occurs. It can also come from red blood cells destruction due to that is lymphoma, infection, autoimmune disorder, leukemia, tumors, etc. Now, types of hemolytic anemia. There are many types of hemolytic anemia, that is, the following disorder and conditions are some examples of different types of hemolytic anemia, that is, inherited hemolytic anemia, hereditary spectrocytosis, sickle cell anemia, a serious inherited disease where the body makes abnormal hemoglobin. This causes of red blood cells to have a sickle shape. Sickle cells usually die after only about 10 to 20 days, as the new bone marrow cannot make new red blood cells fast enough to replace the dying ones. That is thalassemia. Thalassemia is these are inherited blood disorder where the body cannot make enough of certain types of hemoglobin, which causes the body to make less healthy red blood cells than normal. Now, glucose 6-phosphate dehydrogenase. What is glucose 6-phosphate dehydrogenase? Glucose 6-phosphate dehydrogenase, G6pd deficiency. G6pd glucose 6-phosphate dehydrogenase. When your red blood cells are missing an important enzyme called G6pd, means glucose 6-phosphate dehydrogenase deficiency, then you have a G6pd deficiency. The lack of enzyme causes your red blood cells to rupture and die when they came into contact with certain substances in the bloodstream. Pyruvate kinase deficiency. When the body is missing an enzyme called pyruvate kinase, red blood cells tend to break down easily. What is acute hemolytic anemia and immune hemolytic anemia? Then immune hemolytic anemia, in this condition, your immune system destroys healthy red blood cells. The three main types of immune hemolytic anemia, that is, one is autoimmune hemolytic anemia, another is alloimmune hemolytic anemia, another is drug-induced hemolytic anemia. Now, first one is autoimmune hemolytic anemia, which is the abbreviation of AIHA. This is the most common hemolytic anemia condition. For some unknown reasons, AIHA causes your body's own immune system to make antibodies that attack your own healthy red blood cells. AIHA may become seriously and come on you very quickly. Another second point is alloimmune hemolytic anemia, which is the abbreviation of AHA. Alloimmune hemolytic anemia (AHA) occurs when the immune system attacks transplanted tissue, blood transfusion, or in some pregnant women, the fetus. Since AHA can happen if the transfused blood is a different blood type than your body. AHA can also happen during pregnancy when a woman has Rh negative blood and her baby has Rh positive blood. Rh factor is a protein in red blood cells, and Rh negative and Rh positive refers to whether your blood has Rh factor. Now, third point is drug-induced hemolytic anemia. When a medicine triggers your body's immune system to attack its own red blood cells, you may have a drug-induced hemolytic anemia. Chemical is medicine can attach to red blood cells surface and cause the development of antibodies. Another point is mechanical hemolytic anemia and other causes of damage of red blood cells. Now, blood test used to diagnose hemolysis. What is that? Some blood tests used to diagnose hemolysis are red blood cells, also called erythrocyte count. Another is hemoglobin test, the abbreviation is HGB, and another is serum haptoglobulin test. What is the causes? Causes is the immediate causes of hemolytic anemia is the early destruction of red blood cells. This means that red blood cells are destroyed and removing from the bloodstream before their normal lifespan is over. Hemolytic anemia is not always due to an autoimmune disorder, that is of two types. Another is inherited hemolytic anemia. Second point is acquired hemolytic anemia. What is inherited hemolytic anemia? That is, the genes are controlled how red blood cells are made faulty. You can get a faulty red blood cells gene from one or both of your parents. Different types of faulty genes cause different types of inherited hemolytic anemia. However, in each type, the body makes abnormal red blood cells. The problem with the red blood cells may involve the hemoglobin cell membrane or enzyme that maintain healthy red blood cells. What is acquired hemolytic anemia? The body makes abnormal red blood cells. However, a disease, condition, or other factor destroys the cells. Example of conditions that can destroy the red blood cells include immune disorder, infection, hypersplenism. Risk factor: all ages people and all sexes can be affected. What is the risk factor? All ages people and all sexes can be affected. What is the prevention? You cannot prevent inherited types of hemolytic anemia. One exception is glucose 6-phosphate dehydrogenase deficiency. Another is if you are born with G6pd deficiency, you can avoid substances that may trigger the condition. Rh incompatibility lead to hemolytic anemia in a fetus or newborn. Some types of acquired hemolytic anemia can be prevented. For example, reaction to blood transfusion, which can cause hemolytic anemia, can be prevented. This requires careful matching of blood types between the blood donor and the recipient. Prompt and proper prenatal care can help you avoid the problem of Rh incompatibility. These conditions can occur during pregnancy if a woman has Rh negative blood and her baby has Rh positive blood. Pregnancy: if a woman has Rh negative blood and her baby has Rh positive blood. Rh negative and Rh positive refer to whether your blood has Rh factor. Rh factor is a protein on red blood cells. What is the hemolytic anemia in children? What is the hemolytic anemia in children? That is infection, autoimmune disease, cancer, medication, a rare syndrome known as Evans syndrome. Hemolytic disease of a newborn is a problem because the baby can become anemia, which causes further complications. Treatment are available for these conditions. They include blood transfusion and a medication known as intravenous immunoglobulin. What is the signs and symptoms? That is heart murmur, weakness, fatigue, fever, confusion, dizziness, lightheadedness, intolerance to physical activity, or enlargement of the spleen and liver, weakness or inability to do physical activity, jaundice, that is. The most common symptoms of all types of anemia is fatigue or tiredness. Fatigue occurs because your body does not have enough red blood cells to carry oxygen to its various parts. Why jaundice occurs? Jaundice refers to a yellowish color of the skin or whites of the eyes. When red blood cells dies, they release hemoglobin into the bloodstream. The hemoglobin is broken down into a compound called bilirubin, which gives the skin and eyes of yellowish color. Bilirubin also causes urine to be dark yellow or brown. What is the diagnosis? They may also press gently on different areas of your stomach to check for tenderness, which could indicate an enlargement liver or spleen. Many tests are used to diagnose hemolytic anemia. If a doctor suspects anemia, they will order diagnostic test, blood test that help to diagnose hemolytic anemia, that is bilirubin test, hemoglobin test, liver function test, and reticulocyte count. What is bilirubin? Which is a test that measures the level of red blood cells your liver has broken down. Hemoglobin, which is a test that measures the amount of red blood cells you have. Liver function test, and another is reticulocyte count, which is the test that measures how many red blood cells your body is producing. What is complete blood count? Often, the first test used to diagnose anemia is a complete blood count (CBC). The CBC or complete blood count measures many parts of your blood. This test checks your hemoglobin and hematocrit level. Hemoglobin is an iron-rich protein in red blood cells that carries oxygen to the body. What is other blood test? Indirect Coombs test. The test can show whether your body is making antibodies to destroy red blood cells. Haptoglobin, bilirubin, and liver function test. When red blood cells break down, they release hemoglobin into the bloodstream. The hemoglobin combines with a chemical called haptoglobin. A low level of haptoglobin in the bloodstream is a sign of hemolytic anemia. Osmotic Frazzle test. The test looks for red blood cells that are more fragile than normal. Testing for glucose 6-phosphate dehydrogenase G6pd deficiency. In G6pd deficiency, the red blood cells are missing an important enzyme called G6pd. Urine test. A urine test will look for presence of free hemoglobin and iron. Bone marrow test. And last is newborn testing for sickle cell anemia and G6pd deficiency. All states mandate screening for sickle cell anemia as part of their newborn screening programs. Some states also mandates screening for G6pd deficiency. What is the treatment for hemolytic anemia? Blood transfusion to increase the number of healthy RBCs. First one is surgery. Some people who have hemolytic anemia may need surgery to remove their spleens. The spleen is an organ in the abdomen. A healthy spleen helps fight infection and filters out old or damaged blood cells. Blood and marrow stem cells transplant. In some types of hemolytic anemia, such as thalassemias, the bone marrow does not make enough healthy red blood cells. A blood and marrow stem cell transplant replaces damaged stem cells with healthy ones from another person or donor. Bone marrow transplant to increase production of normal RBCs. A blood transfusion is given to quickly increase your red blood cell count and to replace destroyed red blood cells with new ones. IVIG. You may be given immunoglobulin intravenously in the hospital to blunt the body's immune system. Corticosteroids. In the case of extrinsic forms of hemolytic anemia of autoimmune origin, you may be prescribed corticosteroids. They can stop your immune system from making antibodies that destroy red blood cells. What is the medication? Medication is acetaminophen, chlorpromazine, which is known as thorazine, ibuprofen, interferon alpha, quinine, procainamide, rifampin. That is one of the most severe forms of hemolytic anemia is the kind caused by receiving a blood transfusion of the wrong blood type. Some causes of hemolytic anemia are temporary. Hemolytic anemia may be curable if a doctor can identify the underlying causes and treat it. Thank you. If you have any question, so tell me. Thank you.